SMA stands for spinal muscular atrophy. This is a genetic disorder where the nerves which connect our spinal cord to our muscle slowly degenerate over time. As a consequence, the muscles become weak, and that affects the ability to swallow, and so kids are choking and often need a feeding tube. It affects the ability to breathe, and sometimes children need breathing support like a ventilator. And finally, when those muscles of the arms and legs aren't working, kids don't attain the usual milestones of crawling and eventually walking because the muscles are very weak.
At around 4 to 5 weeks of birth, she seemed quite floppy, and her leg movements were very minimal. She wasn't kicking much, and we compared it to her older sister who didn't have any complications. So we went to Emerge here at MAC, and from there, within 2 to 3 days, she was diagnosed.
Zolgensma is a drug that is a form of what we call gene therapy. So with gene therapy, essentially we're giving back the gene that's missing. So the SMA disease is due to a gene defect in a gene called SMN. SMN stands for survival motor neuron, which kind of speaks to what it does. The pricing of the drugs reflects the cost of development because these clinical trials are very expensive, as are the preclinical work. Each drug is negotiated with each individual government, so we don't yet know if it's going to be approved in Canada, and if it is, what that cost is going to be. But one could hand wave and say it's about $2.5 million Canadian. The drug company came up with this concept that outside of the US, where it was approved already by the FDA, in countries like Canada, where it's not yet been approved, the fairest way to provide free drug was to have this lottery system, whereby doctors like myself would say, we've got a kid that we think is deserving of this therapy because they're in the age range where it's been shown to work, and we're not getting optimal benefits from our current therapies, so we would like to apply. We have 2 kids from our clinic, both under 2 years of age. His name is Wyatt Vassy, and his family are delightful and wonderful people, and he had his infusion last week.
When Wyatt was a couple months old, maybe four months old, we started noticing that his breathing was really off. He was doing a lot of stomach breathing. He wasn't able to really lift or hold his head up much. He wasn't doing much movement. So we started investigating, which led us to coming to MAC when he was about 6 months old. And Dr. T diagnosed it within 2 days of us being admitted. Infusion day was phenomenal. It was we were very nervous heading into it just because, we'll make sure everything goes smoothly. When the drug finally was done and they took off the syringes at the end of the infusion, you just kind of have this big sigh of relief. We're happy and very grateful that we were selected.
We're here today with Chloe Souza and her parents and the whole support staff and team, and she is getting her gene infusion. We'll keep a close eye on her over the next month or so, and then we'll let nature take its course, and hopefully we'll see her up and about walking independently.
We were in the lottery since March, and her name was never chosen. So we were starting to give up hope. But when she did get chosen, we both kind of cried and screamed at the same time, just because it changes her life so drastically. For us, I could say we just want her to live the longest and healthiest life along her sister. We would love to see them one day walk hand in hand, side by side. That's my dream.